so now we're going to be correcting that upslip. Again, if you didn't have other corrections, which is pretty uncommon, I'm doing these in the order of what's most common and most important to correct, but if they for some reason had an upslip and they didn't have other issues presenting, then you'd want them to do that yoga bridge and a little traction again. But he's all set up and ready to go because we've just been moving along. So we're going to correct that upslip. So I set his leg up like this, and then I'm going to use my hands like pretty flat, and I'm going to go in and get the thigh here. So I'm going to twist the flesh in, and I'm going to traction away from the hip. So you just want to make sure you're not snake biting somebody, especially if they have bare skin, just kind of checking in with that. And then also that you don't like pull their hip off the table. So you're tractioning, but you're tractioning like the twist and then kind of down. And so his hip's going to remain on the table. While I twist and traction, he's going to slide his hip up towards his armpit. So it's that hip hike action again, right? So it's just this. People they'll want to kind of go like forward sometimes, but you got to remind them it's slide, keep the hip on the table, slide it up towards your armpit. That's a hip hike. Sometimes they may torse and get all wonky in their upper body. If you feel like it's so much that they might create an issue, you can like remind them to line up their upper body, but a lot of the time it's just information for you and not that big of a deal. So then they'll cough and release it. And again, however they do their cough is fine as long as it is a cough and not just like, it has to engage the system because it's that neural distraction that actually creates the release. So I'm gonna twist and traction, nice deep breath in. I don't traction until he's exhaling, especially with him because he has a lot of lung capacity. So his nice long breaths are truly nice long breaths. With a lot of people, it's not the case. Big breath in, exhale, hip hike, slide up towards that armpit. Good. And so I have traction on him this entire time. And then breathe in, nice big belly breath, and cough and release the hip. Good. And so it's that simultaneous action. I still have traction. Now I can relax it. But that part is key. You're keeping the traction the entire time, and then they have to cough as they release. Sometimes you'll get that so like they'll cough and then let it go. You sort of want it to be like one action. So you got to demo. You have to give a lot of direction before you get someone in here into this position, because it's a lot for your body. It's a lot of effort for their body. And you don't need somebody to feel bad again and again. You only want to do this a couple of times, this move maybe twice, maybe 3 times tops. And so you want to make sure that they understand what you're talking about. Obviously, if they're doing it incorrectly a couple times, you can still do a few more reps, but if they're getting it right then. So nice deep breath in, relaxing exhale. I'm twisting and tractioning, pulling that hip down, twisting it in, that internal rotation. Big deep breath into the belly. Slide your hip up towards your armpit. Good. Breathe in. And cough and release. Good. So the rest of their leg is relaxed, and that's another thing a lot of the time people's leg like engages tremendously. You can work with it, but you want to remind them to relax their leg, relax their leg. This is low back hip action. Nothing else really needs to be engaged on them. He does a great job. A lot of people really engage a ton. You know how hard it is for people to relax. So that's another reason that all this deep belly breathing is helpful, because it helps the system soften, relax, begin to trust that they're safe with you so that they can let this go. All right, so that was the upslip correction.